What really defined oral health in seniors for me was my own mother.
I do realize and I know that you should try to keep your own teeth as long as you can.
Unfortunately, I think a lot of the times the thing that gets not done is teeth.
It's very definitely a rewarding place to be, to know that you have the opportunity to really improve the quality of life for someone.
I've always been so concerned about how you look. I mean, as far as my mouth and my teeth, and I would say the first thing I notice when I see a person is their mouth and their teeth.
We've had folks who haven't wanted to come to the dining room because they didn't want to sit at tables with other residents because they would have to maybe have a pureed diet because they didn't have teeth and had trouble chewing, and they didn't want to want other residents to see them eating pureed food. So I think sometimes we think because people are getting older that they don't care about appearances and self-esteem, and that's not true, and I think sometimes we overlook that.
Just because they're older, that doesn't mean that they're not interested in how they look, how they feel, or what should be done for them, or what food they should eat. I mean, we should give the integrity of their life. They work so hard for so long.
I've heard so many people say if you let your teeth go, why other problems come up with your, well, whole body. So it's very important.
Good oral health has an impact to your entire body, and part of it is nutrition, and in the senior population it affects the body because of a variety of meds that the senior may be on, or other health issues including diabetes and cardiovascular disease.
A lot of the residents in the facility have oral problem. I will give you some example: gingivitis, xerostomia, which is dry mouth. And based on the fact that those patients are taking multiple medication that can cause dryness, you know, the decrease of production of the saliva, put them at risk. We got about, I would say, 50% of the residents in the nursing home carry a diagnosis of diabetes, which is also a major problem, not having a good, proper oral care.
The mission of the Office of Oral Health at the Massachusetts Department of Public Health is to improve and promote oral health for all residents of the Commonwealth, but most especially vulnerable population groups, which includes seniors. Massachusetts residents over 65 years of age make up 13% of the state's population, and that percentage is growing. Nearly 50% of seniors living in the community have not had a dental visit in the last year, and about 20% have not had a dental visit in more than 5 years. 79% of seniors living in the community do not have dental insurance. 65% of seniors living in long-term care facilities have some natural teeth, and 13% have most of their natural teeth. 59% of seniors living in long-term care facilities and 35% of seniors living in the community have untreated tooth decay. The Commonwealth recently instituted a new scope of practice for dental hygienists. Public health dental hygienists work in a public health setting. It's our hope that these dental hygienists will increase access to dental services for seniors living in long-term care facilities, utilizing meal sites, as well as those people that are homebound.
Basically, what we're trying to do is reach a population that is considered the underserved population. So we're trying to hit those places or facilities where we can best provide our services to them.
I think there is always room for the creation of new avenues, or different ways of delivering care. I think if you add that with a little independence, which is what the public health dental hygienist is, I think you close the gap for access to care.
A dental hygienist that would be able to come into the facility, first of all, offsets that whole issue of trying to get them out of the building to see someone so they can be seen here on a more regular basis.
We really are a very portable profession, and I think we can really provide a valuable service to be able to just bring our equipment with us and set up in a location for a day and provide care for people who aren't able to get into a dental office otherwise.
The nurses in the facility do an oral assessment when people come in, when they're admitted to the facility, and then we do one annually. We do the best we can, and we probably see grossly abnormal things is what we noticed.
We're not really knowledgeable versus a hygienist who basically that's what they do. You know, they look for any abnormality, they do the prevention. So having them will help us and actually will be beneficial to all of us to have that in place and help us coordinate a better plan of care for the patient. We don't want to send them different places all the time. We want to see somebody that will remain with us and help us out, teach us, teach the patient, teach the family. That's what we need. I mean, having a public health hygienist coming to our place is the best thing. We talk about continuity. This is continuity. This is what we need.
I think there are many hygienists out there who would really love the opportunity to be in a non-traditional setting with all of the challenges and rewards that it poses for you.
I think this is probably one of the most rewarding things, is it allows an independent person who's a self-starter to get out there and sort of set up their own day and also be able to regulate themselves as they practice. So these patients will get the care they need, at least preventive care, if you will, and they feel very comforted knowing that they're getting quality care and that they're going to be taken care of and that they're not abandoned. And I think that in itself speaks volumes.
Seniors shouldn't be the forgotten population when it comes to oral health care, because they shouldn't be the forgotten population under any circumstances.